Hi, I'm Dr. Amit Bhandarkar from S.P.I.N.E Center, Chesterfield, and we have with us Dr. Parikh.
And I am Dr. Purvi Parikh. I'm an endocrinologist. My practice name is Endocrine and Obesity Solutions.
Perfect. So we are here to talk about osteoporosis. We both have been treating osteoporosis. I'm more on the surgical side, and she has been treating patients with medications, early diagnosis and treatment. Why don't you elaborate on what you do, Dr. Parikh, for patients with osteoporosis?
Sure. So osteoporosis is a pretty common condition. It is a disease that is diagnosed when there is loss of bone mass or the bones become weak. Most people understand or know osteoporosis being a condition present in older or postmenopausal women and in older men, but actually osteoporosis is or could be present in younger people also. We just have to keep an eye out for that. The reason we need to be looking for this condition is because it is easily diagnosed and treated and can really reduce the risk of fractures and a lot of morbidity associated with it. So I do think that it is an important condition, and I'm glad that we are talking about this.
So let's go ahead and explain to our audience what is osteoporosis, what actually happens to the bone in osteoporosis.
Sure. So the bone is normally a strong organ in our body. It supports us, right? We walk on it, we lift things, we do everything using our muscles and our bones. But when the bone structure is weakened, when the structure there are imagine like a porous sort of holes in a strong bone, and when that gets worse as we age, it increases the fragility of the bone, and they tend to fracture easier with little trauma. We have little traumas to our body, in just routine life, right? We bump into things, maybe we fall on ice or whatever. But if we have strong bones, normally they won't fracture unless there's a lot of weight that falls on it. Then that can happen to a normal bone. But when the bones become weak, the structure is weakened by a lot of different cavities or porosity. That's when we just basically, osteoporosis is a porous bone. Porous bone is with a structure that has a lot of cavities in it and fragility.
Yeah, so it's basically a structural problem.
It is.
So I think, we say the bone is made up of a lot of organized small structures inside which support the bone as a whole, and those small structures, or trabeculi as we call it in technical language, becomes more weak.
Yes.
So the overall structural integrity of the bone is compromised. As we say, the mineralization is not compromised, right? They are mineralized, but the overall structural count of those supporting beams inside your overall structure is less, and that's why they are more vulnerable to fracture, even with some trivial kind of injuries or incidents, like you miss a step and you fracture a bone. This is very common in postmenopausal or women or men above certain age, say 65 years of age. But nowadays, because of the way we eat food, and we are protein deficient, a lot of people are, and if they are having chronic illnesses, they may have this condition early on,
or some medications can induce it
too.